on an open surface that is readily accessible. Make sure that approved biohazard sharps receptacles are nearby, since intraosseous cannulas are not equipped with retractable safety needles. Follow standard precautions. Wash your hands prior to any contact with the patient. Whenever possible, identify the patient using 2 identifiers, such as name and date of birth, before beginning the procedure and whenever a procedural timeout is initiated. Explain the procedure to the conscious patient and to any family members who are present. Position the patient so that the selected insertion site is easily accessible. Wear protective eyewear and sterile gloves. Using aseptic technique, clean the chosen insertion site with either chlorhexidine or povidone iodine solution. In awake and alert patients, infiltrate the area with lidocaine to provide local anesthesia. When using manual insertion, remove the safety cap from the needle. Ensure that the stylet is appropriately placed within the needle and that the bevels are aligned. Using your non-dominant hand, stabilize the limb distal to the insertion site. This allows for counterpressure against the advancing needle and prevents unexpected patient movement. Make sure that no portion of your hand is behind the insertion site to decrease the risk of needle stick injury. Place the needle handle in the palm of your dominant hand. Place your thumb and forefinger along the shaft of the needle for stabilization. Place the needle against the skin overlying the site. Puncture the skin and continue through the soft tissue. Use firm, steady pressure and a rotating or coring motion to penetrate the bony cortex. You will note a sudden give with the loss of resistance as you enter the medullary cavity. Remove the needle cap and stylet. If the device has a supporting flange, adjust it so the surface is flush with the skin to stabilize the needle and to avoid inadvertent deeper insertion. Take care to avoid disrupting the needle while adjusting the flange. For power-assisted insertion, we will demonstrate use of the drill device. Select the appropriate needle size based on the patient's weight. The pediatric needle is designed for use in children weighing less than 40 kilograms, unless large amounts of overlying soft tissue predict the need for a longer needle. Remove the needle from its protective container. Attach the needle set to the driver, allowing the magnetic pull to hold it in place. Turn the safety cap clockwise to remove it. Pull it off the needle. Place the needle against the skin overlying the site, 1 to 2 centimeters from the adjacent physis. Apply gentle, steady pressure while engaging the trigger to allow the needle to penetrate the soft tissue and then the bony cortex. Once resistance decreases, marking the entrance into the medullary cavity, take care to release the trigger and allow the driver to stop spinning before pulling back or disconnecting the needle. Gently hold the needle and pull the drill directly backward and off the needle to disconnect. Turn the stylet counterclockwise to unscrew it and gently remove it from the needle set. A number of methods can be used to confirm catheter placement. First, the needle should stand on its own because of the lateral support of the bony cortex. Aspiration of marrow contents also signifies that the catheter is likely to be in the appropriate cavity. However, it is important to note that absence of blood return can occur even in a properly placed intraosseous catheter. Absence of local swelling at the insertion site with infusion also indicates correct placement.